So today I'm going to do an O2 scenario, and so the first thing I'm going to do is check the patient's chart. And I have noticed that they had an ABG done and that their CO2 and their O2 were a lot lower than they needed to be. So the doctor had asked if I could place on a non-rebreather. So first thing I'm going to do is knock on the patient's room, introduce myself, and then I am going to check the patient's ID band, and then I'm going to wash my hands. And before I place any oxygen on, I'm going to check their vital signs and before I place oxygen on. So I'm going to start them off with this non-rebreather. This will help kind of retain that CO2, and it will help with the oxygen levels, get them back to where they need to be. And with the non-rebreather, you need to make sure that it properly inflates, that the bag stays inflated, and then you need to watch the patient so when they breathe in and out that if the bag completely collapses, then I need to raise the liter flow up just a little higher. So I'm going to place this on you. This is going to help you get your levels back and hopefully help you feel a little bit better. That way you can get back to normal and get back on your feet. So I set out an oxygen, no smoking sign outside. I ask that anybody that comes in here not to mess with any of your oxygen and not to play with your bag here with your non-rebreather, okay? I'm going to come back after a bit and I'm going to recheck your vital signs to make sure you're getting the appropriate setting. So I come back and the doctor later on, they had performed another ABG just to make sure it is the appropriate device that we had chosen, and they noticed that the levels are going back to normal. And so then after they have been on it for a little while and the doctor would like to start to wean them off, and so they had lowered the flow, and so I'm going to change them to nasal cannula, and that way they can begin to be weaned off the oxygen. So I'm going to change this off. They were at a lower flow with this, and they're going to go to a nasal cannula. So I'm going to set them at the appropriate flow for them. Alright, so here we have a nasal cannula, and this is just going to help you, and we're going to start weaning you off of oxygen, okay? Your levels are going back to normal, and so I'm just going to make sure that you are getting the appropriate oxygen still, and I'm going to come back and check on you. So with this, needs to stay behind your ears. I'm going to place it in the nose, put it behind their head, and then, alright, so please don't remove this, as this can cause irritation to your nose, and it can also cause irritation to your ears. It can cause some sores, and then it's going to be very uncomfortable to wear it, okay? And I figured with this, then you would be able to eat without having to remove it. And then also, if you notice any dryness, especially where it's at a higher flow, I can add on a humidifier, just that way it gives you the humidity, or I even can do a water soluble lubricant, but please don't put any Vaseline in with the nose, as that can cause combustion with the oxygen. So once they're done, I can always come back and check their vital signs, make sure everything is okay, everything's looking good, their skin tone is still normal, not turning red or anything like that, and let the doctor know that I placed them onto the nasal cannula to start weaning them off of the oxygen.